Hello church family, welcome to my channel once again. My name is Church Girl. If you are new to this channel, welcome and thank you for joining me for today. Please don't forget to subscribe right below and also give your girl a thumbs up to give me some encouragement. Okay, we need to go places, so please do your job. Today we are going to be talking about wound care. For those of you who don't understand my accent, maybe too hard to understand. Wound is when someone have a cut on their skin, okay? An open wound, a cut on their skin, and it keeps growing day in and day out. It gets bigger and bigger. It may start off small, and it keep getting bigger and bigger and bigger every time. That is what I'm going to be talking about, especially those who have diabetes. I cannot stress this enough. If you have diabetes, you have to really help yourself, so that you don't get yourself cuts, because it can get out of control. And I hope your doctors will advise you on that. And one thing we have to know about wound care is you have to eat. Okay, you have to eat nutritious diet, because what goes inside also is the same thing which is going to help heal your wound nice and effectively. Okay, what happens is when you don't eat enough and your body needs nutrients, this is what it does. It goes to where you have a weakness. Okay, the place that you may have a weakness is where you have the cuts. Okay, around your skin, it can be your feet, your hand, wherever the wound is. Okay, that is where it goes, and it starts taking nutrients from it. So when they start taking those nutrients, then it keeps growing bigger and bigger. Especially those who are who have like bed sores, who may be in the nursing homes or hospitals. Please, if you have a loved one in the hospitals or nursing homes, let me tell you something. Nursing home does a really good job in checking for wounds on the body of the patient. But when someone is being transferred to the hospital, it's a different thing, because when you go in for heart problems, their main focus is going to be the heart issues. They don't really check the body. So if you have a loved one, go, and even when they cannot, they are in coma, or what, even if when they are in coma, try to look at the back of their head. They may have due to the bed pressure, they may have bed sores at the back of the head. Try to check when the nurses are changing. When you are there, try to also work with them. Go early in the morning, so that when they are changing, you'll be able to get a good view of what is going on, because before you know it, you are going to regret it. Okay, so make sure that you keep that in mind. That is just a side note. So when you have this wound, most people, when they have this wound, they will see fat, like some form of fats on top of the wound, especially when it gets really big. When that fat is on top of your wound, whatever medicine is put on it is not going to work. That is the truth. Why? It's because it acts as a shield, a barrier. Okay, it acts as a shield, just as we use Vaseline to rub on babies' bum, so that when they pee in their diaper, it doesn't cause rashes on their skin. That is the same thing, and this fat is really thicker than even Vaseline, because it adds it will be like a guarding the wound. Okay, especially those who have diabetes, when that fat is on top, within inside is eating into the skin, like a bacteria is eating inside. So the fat is here, and within it, on the layer at the bottom, is being something like a bacteria is eating into the wound. And before you know it, when this one cave, which is the fat, when it caves or it breaks away, you're gonna see that your wound, there's a hole in it, almost like to the bone. Some people, they don't know what happened. They wake up one day and it's like their wound is like an open wound to the bone. It's so deep in a way that they don't know what to do, and they become really stressful about it. That is what happens because of the fat. It's deceiving you, making you feel like it's just superficial. It's just a little thing on top. You just need to heal it. No. It's way deeper than that, especially those who have diabetes. That is why I'm stressing this, okay? So when you have that fat on top, you have to melt that fat before you start treating it. Whatever treatment that you do, you have to melt that fat. And that is a trick that most in hospital settings, they are not able to control some of the wound when it gets to that layer, because some of them don't know that trick, okay? And when it gets worse and it becomes necrotic, there's no oxygen, you know what I mean, your body don't get any oxygen to that part, it dies, and they cut it off. and you become amputated. Most people who have been amputation, they don't have, it was really unnecessary, but it was just, they didn't know what to do, and it became that way. Trust me, I have just the thing. It's tried and tested. Regardless of your age, please. You can be 90 years old. You may have a grandfather or a grandmother or a mother who is old. You can, because I've had people who are in their 80s, and they are not just having that wound. They have multiple problems. Some people have kidney issues. They have liver issues. Some people are even on dialysis. And when they did this, it's cleared their skin. Really, the wound was gone. And if I should show you what it was, some of them had their wound where you'll be surprised that they were able to take care of it. So please stay tuned. I'm shooting by myself, so I will be showing you the ingredients shortly and telling you exactly what to do. Okay, stay tuned. Okay, so I have the ingredients here that I will show to you. Okay, so what I was saying, if you have the fat on top of this, on top of your wound, okay, I'm using the back of my palm on top of your wound, you need to melt it, and all that you need is papaya, ripe, really ripe papaya. In my country and other parts of Africa, we call it pawpaw. That is papaya, okay, not the seed, not the seed. You need the meat, okay, the meat, the actual papaya, okay, like I'm scraping. Let me show you, like I'm scraping here. You see, you need the meat, not the seed. By the way, if you have fresh papaya like this, what you can do sometimes is what they call a scoop. I'm gonna scoop it and show you about this much, okay, and swallow it. It's just on the side. This is good for worms, okay, so that you don't get parasites. It's really, really good. You swallow it. It's easy to swallow, like I swallowed mine. So you get the fresh, you get a ripe papaya, okay. What you do is you scoop it, you mash it really, really well. Apply on the wound, okay. Apply it on the wound. You can use cotton. Sometimes people will have, like, maybe the cotton may get stuck in it. You can just apply it like this and put gauze, something on top. When you do it for about 3-4 days, you see that the fat is melting. The fat which is hovering on top will be melting. This papaya contains procrein in it, okay. Procrein in it. It has penicillin. It does, papaya also does have penicillin in it. So when you have, especially the unripe papaya, the water that comes out. So papaya is not just the sugar in it. That sugar is going to soften it. Just like exfoliating your skin, it's going to soften the fat, and it's not going to cause any infection because this have a lot of enzyme in it, the papain. It will not going to get infected. Okay, so once you get it good, you clean it up, okay, you get it good, spread it on it. Maybe you do it in the morning, in the evening you wash it out. The next day you repeat it. Keep repeating till the fat melts before you start treating it. Okay, let me show you. So there are basic wounds. Some people have very small cuts and they just want to get rid of it. Okay, if you have a small cut, this is scent leaves. This is scent leaves, okay. It's in the family of mint, scent leaves. You call it scent leaves. It's really, really good. When you blend it and you put it in your wound, okay, you can crush it or blend it or on a stone or in an earthenware, whatever you want to do. Apply it on wound, especially the small wound. Do it regularly. You are going to heal yourself, okay. So these are the basic ones. I'll get to the big one. These are basic ones, okay, that you can do. Also, I have this. This is dried up. In Ghana, this is known as tutumika konshapo. Let me clarify this. Some people from Ghana are watching this. So this is nunum. That is scent leaf nunum, okay, the one I first showed. This is Agaratum cornizoid, okay. This is how it looks. It's also another leaf that which is very powerful in healing wound. Even when it doesn't matter how big your wound is, all that you need is you can get vodka, okay. Don't get 70%. You can get like 50% vodka, and wipe the wound, around the wound, all the dead cells around it. When you get a fresh one, I have the dry ones here. That's what I'm showing. When you get a fresh one, just put it on top, put it inside on your palm, just like you do like this. Let me show you. This is how we do it in Africa. You rub it. So once you rub it, you keep rubbing it. If you have more and you keep rubbing it, the juices, all the juices are going to come out. When the juices come out, you just squeeze the juices, those juice on top of the wound. Then after that, the leaves are going to be a little bit wilted or soft. Put it on top as band-aid, okay, before you wrap it. Even if you have nowhere to go and you're home, you can just leave it on without not wrapping it so that you can have fresh air. It also helps, okay? You don't want to be covering it to create heat on it. These leaves are Agaratum conozoid. In Ghana, this is known as Tuturumika koshepo. In another part of Ghana, is known as Yakankai, Habakankai, or Egwekuru. Okay, those who are from Ghana, from different parts, I have mentioned the names that I know. Very common names, Tuturumika koshepo. That is the leaves that you can put on your wound. This is also Kalanchoe pinnatum, okay, or Bromophilia pinnatum. That is Kalanchoe. This is miracle leaves. When you hoover this on top of fire, okay, it will get soft. Do the same thing like I did. Rub it between your palm and squeeze the juice inside and use the leaves to cover your wound. This also heals your wound. You can also chew this, okay? You can also chew this. And it also boosts your immune system. It helps with infection. It has anti-inflammatory properties and antibacterial. It's really, really good for you. All the leaves I mentioned can be eaten. Please. So now we are here on the money. This medicine that I have here, as you can see, I have a snail shell. I know some of you are wondering how I got it. I have a snail shell. This is a snail shell. Okay. There are two types. There are different kinds of snail shell. We have the Akakatina, which is this one, and we have the Marginata, Akakatina marginata, which is the one with the black shell, with a black skin. Okay, the black what do you call it, shade or whatever on the skin. So I have this. This is African land snail. African land snail. I have always used the African land snail for this purpose. You can use this, or if you have the one with the skin, this is the one I have here. You see, the skin is black. What I did was it's broken into pieces. This is what you do when you have the snail shell. Have an open flame. If you live in North America, your barbecue, okay, when you put it on it and leave it, you stay there, leave it, it's gonna burn and turn white. You see how this is so white? It was black. This is the black kind. This one that I have here is the black kind. Let me show you. You see, and it turned this, the skin test. When the skin becomes white like this, that means it's easy for you to grind it. You have to crush it into pieces, just as I have done. So you see, I have this into powder. This is what you need, okay? So let me repeat it again, because this is magic. If you know what snail shell can do for you, you start collecting this. This, you put it on an open flame. If you live in Ghana or other parts of Africa, whether it's your open flame, whatever you do, your fireplace, your coal pots. In North America, you can do it on your barbecue. You put it inside, so it all turns white. It's going to turn white. You see, from black like this, and it's gonna turn to this. Okay, that is where you remove it, crush it, grind it into powder. If you don't have a grinder, use a mortar, anything that you can use it to get into powder. If it's not that fine, what you can do, you can put it in a strainer. Strain it, okay, to get it fine. When you put the powder just like this, sprinkle it on top of the wound. The wound is gonna heal from the superficial level. It's gonna heal, but the inside is not going to heal. You understand? If you sprinkle it just like this, it's going to work to heal the top part, but it's not gonna get on the inside. So this is what you do. You give me 1 second. I have it here. I think I knock it over. I have here, family. I have coconut oil. Okay, if you have olive oil, you can use olive oil. If you have palm kernel oil, that is one of the best. Palm kernel, not palm oil, palm kernel. The kernel, the nuts that they make oil. This is coconut oil. That is this was brought to me from Ghana. Okay, you can use the one here, the cold press. You can use that one. You have to mix this. You have to mix this powder. Okay, the snail powder, the snail shell that you have powdered, you have to mix it with an oil before you put on the wound. That way it goes inside the wound, heals inside and heal the top. If you get this and you start doing it within 6 weeks, if your wound is about this big, it's going to shrink. You'll be surprised. You will be surprised. Please give this a try. Please give this a try. Also, if your wound is either small or not small or big, you can also use honey. But one thing with honey, one thing with honey is because you cannot trust the market. Some people add sugar to it. This is pure honey from Ghana. They did not put it through any machine. So you can even see some of the bee stingers in it. They did not put it through a machine. They use their hand in squeezing it. You see how it is? If you have a proper honey, when your wound is clean, you clean it with alcohol. Whatever you use to clean it, your wound, to clean the dead cells around it, you can apply a thin layer of honey on top of your wound. That also works magic, but you have to get the correct one, the actual honey. Okay? So if you can't trust your honey sauce, please don't use honey. You don't want to make your problem worse. So this is what I have for you for today. Please make use of it. If you have any question, don't forget to ask me, and I'll answer your question as best as I can. As soon as I see it, I'll answer your questions. So please make use of it. Okay, once again, my name is Church Girl. If you are new to this channel, please don't forget to subscribe right below, and also give your girl a thumbs up to give me some encouragement. Thank you and have a blessed day. Bye bye.